Here's the room. There is the piece of paper, my ID, and all my tools. The patient's going to start by walking in so I can assess the gait and general appearance. So gait is normal, no shuffling noted. Patient appears stated age and healthy. Can you tell me your name and birthday?
Kayla Rankin, 4594.
Okay, perfect. My name is Bailey. I'm going to be the nurse practitioner assessing you. So I'm going to start with hand hygiene. Wash my hands. I'm going to put gloves on. Can you tell me what time of day it is?
I think it's about 5:45.
Good. Perfect. And who is the president? Perfect. All right. I'm going to start with taking vitals. Can I see your arm? I'm going to assess the pulse. Good. Blood pressure is 116/76. Heart rate was 68 and respirations was 16, which is all normal. I'm going to check your temperature real quick. 98 degrees. Good. Next, I'm going to do a head-to-toe assessment. We're going to start by drawing a clock on this circle. I just need you to put the numbers, and we're going to draw 2 o'clock. Good, that's correct. She drew 2 o'clock. And then I need you to remember 3 words, and I'm going to ask you at the very end of the assessment what those 3 words are. So the 3 words I need you to memorize are blue, black, and watch.
Okay.
Okay? So I'm going to start by assessing the skin. I'm going to go down, look for any lesions. Nope. When was the last time you saw a dermatologist?
Probably about 6 months ago.
Okay, good. Skin color is normal for ethnicity. Temperature is warm and dry. No bruising noted and nothing abnormal. Do you have any pain with your skin or any concerns that's noted?
No.
Okay, good. Next, I'm going to check for skin turgor. No tinting noted, so no signs of dehydration. Good. Next, I'm going to focus on the head, eyes, ears, nose, and throat. So I'm going to assess your scalp. I'm going to palpate it and look at your hair. Any pain when I palpate?
Mm-mm.
Okay, good. No signs of any alopecia. Hair distribution is normal. Any pain at all? Okay, good. Head is normal, cephalic. I'm going to go down. Can you raise your eyebrows for me? Good. Can you frown and smile and then puff your cheeks up with air? Good. That's assessing the cranial nerves. I'm going to assess your jaw, clench your jaw, and then your temples. Release. Okay, and then I'm going to assess for TMJ. Open and close. Good. No popping or clicking noted in the jaw. Next, I'm going to test for sensation. So this is going to be dull, and this is going to feel sharp. So close your eyes and tell me which one you feel.
Dull.
Good.
Sharp. Sharp. Dull. Dull.
Good. That is normal. Next, I'm going to focus on your ears. I'm going to palpate and inspect. Any pain here? Okay. I'm going to do the whisper test.
22, 13,
Other side.
22, 43, 55.
Good. That's intact. Next, I'm going to actually look inside the ear. First, I'm going to do a hearing test. So, I'm going to put this on your forehead and tell me if you hear it equally in both ears, okay?
It's equal.
Good. Next, I'm going to put it behind your ear and to the side. I'm going to say 1 and 2. Tell me which one is the loudest. This is 1. And this is 2.
2.
Good. I might come to the other side. This is 1. This is 2.
2.
Good. That's normal. And that's the Weber and Wren test. Next, I'm going to take a look inside your ears. Tympanic membrane is good and the correct color. No abnormal swelling or redness noted. Any recurrent ear infections that you're aware of? Okay, I'm going to check the other side. Good. Tympanic membrane looks good. No swelling or any abnormalities noted. Good. Next, I'm going to move on to your eyes. We're going to do a few eye tests. So I'm going to assess your peripheral vision. Can you tell me what number I'm showing?
1, 2, 3, 4.
Good. And then I follow my finger with your eyes. Good. And then I'm going to look at your pupils. Stare straight behind me. Good. Pupils equal, round, and reactive, and they do accommodate. Next, I'm going to check the sclera. Sclera is pink, conjunctiva is pink, sclera is white, which is normal. Any problems with your eyes? Do you wear glasses or contacts?
Contact.
Okay, we're going to do an eye test. Close one eye and read as low as you can on the chart.
LTFPH.
And then close the other eye and read that line backwards if you can.
HPFTL.
Good. All right. And that is 20/20 for acuity. Next, I'm going to move on to your nose. Any pain with your nose? Have you ever broken your nose? Okay. Any sinus trouble?
No.
Okay. Any pain when I palpate?
No.
Okay. Nose looks symmetric. I'm just going to take a look inside your nose. Tilt your head up for me. Septum is midline. No nodules or any abnormal drainage noted. Same on the other side, looks good. Actually, I'm going to go back and look at the back of your retina real quick. So, stare off behind me, okay? Hold real still. Good, retina looks healthy. The red reflex was present. So we're going to go back to the nose. Septum was midline. No abnormal drainages. No pain upon palpation. Next, I'm going to go on to your mouth. Can you open your mouth up for me? Okay, I'm going to shine a light in there. Good. Palate is intact. Mucous membranes are moist. Can you stick your tongue out for me? Good. I'm going to elicit your gag reflex. It's intact. Can you stick your tongue to each side and push against my hand? Good. And then stick your tongue out and say ah.
Ah.
Good. All right. Next, we're going to move on to the neck. Skin is clean and intact. No lesions noted. Patient's trachea is midline. I'm going to assess the thyroid. Take a swallow for me. Good. That's within normal limits and normal size. Can you shrug your shoulders up and push against me? Good. I'm going to check for any enlarged lymph nodes. Good. No enlarged lymph nodes noted. Next, I'm going to listen to your carotid arteries. First, I'm going to palpate one at a time. Good. 2 plus. Good. No worries noted. Everything sounds good. Next, I'm going to move on to your heart. Can you lay back on that pillow for me? Oh. I'm going to pull it up underneath you. Turn your head to the left. I'm looking for jugular vein distension. And that is, she has no jugular vein distension, which is good. You can sit back up for me. I'm going to listen to your heart sounds. Do you have any heart problems? Any history of congestive heart failure? Okay. I'm going to lift her shirt up real quick. Good. I'm going to palpate the point of maximum impulse, which is the mid-clavicular line, 5th intercostal space. Good. No deviation noted. Next, I'm going to assess the lungs. So I'm going to listen to the lungs. Chest is symmetrical. No abnormalities noted on the chest. She has normal expansion, normal respiratory rate, which I assessed in the beginning. Deep breath. Good. I'm going to assess the lungs on each side. And then on the other side. Good. Can you stand up and turn around for me so I can listen to the back? Perfect.
Do you need my shirt up or?
That's fine. Deep breath. Good. I'm going to assess tactile fremitus, so I'm going to need you to say 99 when I put my hands on your back.
99. 99. 99. 99.
And then I'm going to assess for chest expansion. And good, that is normal. You can put your shirt up, perfect. And then if you'll turn around for me. So chest is normal, lungs sound good and clear in all lobes, anterior and posterior. Next I'm going to move on to your abdomen. Can you lay back for me? Okay, I'm going to assess the abdomen. There's no any bulging, any pulsations. Are you having any pain? Okay. I'm going to start by looking and inspecting. Everything looks normal. Then I'm going to listen to her. I'm going to listen to the aorta. And then the renal arteries. And then the iliac arteries. I'm going to palpate. I'm going to lightly press, tell me if there's any pain. No bulging noted. Next, I'm going to do deep palpation. Any pain here? No abnormalities noted. Can you lift your head so I can assess for a hernia? No bulging noticed. Okay. Next, I'm going to try and palpate and percuss for the liver and the spleen. And then I'm going to go from the top. Okay. And then I'm going to palpate the edge of the liver. Take a deep breath in for me. Good. Next, I'm going to percuss the spleen. And then I'm going to try and palpate the spleen. The spleen is not palpable, which is normal. Okay. Any problems with your abdomen or any problems with diarrhea or constipation? Okay, good. You can sit up for me. Next, we're going to move on to the vascular system. I'm going to assess the skin again and the temperature. Everything is normal. I'm going to look at her fingers and assess cap refill on all fingers. Other hand. Cap refill is less than 3 seconds, which is normal. Then I'm going to look at the fingers for clubbing. There's no clubbing noted in her fingers. Next, I'm going to go down her legs. I'm going to assess, lift your feet up for me.
Sorry.
You're fine. I'm going to assess the pulses in the feet, the dorsalis pedis, and the posterior tibial, which are all 2+. And then check cap refill in her toes. Cap refill is less than 3 seconds, and I need to check her pulses in her wrists, which is 2+, and then the brachial. 2+ as well. Good. Next, we're going to move on to range of motion. So I'm going to ask her, can you roll your neck in a circle? Good. Can you go up and down and side to side? Good. Any pain there? Okay. I'm going to palpate all her joints, so the wrists, the elbows, and the shoulders, the hips, the knees, and the ankles. Any pain in your wrists? No? Have you ever fractured your wrist or anything? Okay. Can you move your hands up and down, side to side? Spread your fingers out and close them, and then go around in a circle. Good. Can you open your elbows up and bend them? Good. And then your arms are going to go up and then back behind you. And then we're going to go up like your muscles and then down. Good. So shoulders, no pain in the shoulders at all, in the joints?
No.
Good. Next, we're going to lay all the way back, and I'm going to look at your hips. I'm going to palpate the hips. No pain here. Good. I'm going to lift your leg up. And then we're going to go across and then out. Same thing with the other leg. And across and out. Good. You can sit up for me. And then for the knees, we're going to kick out. And then bend. Out and bend. And then we're going to turn them out and then in. Can you do that on the other one? Good. Can you scoot back so we can see the ankles? Perfect. So the ankles we're going to point, and then we're going to flex them, and then we're going to roll them all the way around. Good. Next, I'm going to assess your reflexes. You'll come back up to the edge of the bed. Good. Good. And then can you scoot back so I can show them the Achilles? Good. And then what are those 3 words that I told you at the beginning?
Black, blue, watch.
Good. All right. Do you have any questions?
I think so.
Okay.